Well, hello and welcome to Inside Health on Signature TV, your health show where complex health issues are broken down into bite-sized information that will help you take care and take charge of your health and well-being. Well, today we have a very deeply personal, in my view, and very relevant topic: infertility. The costs of infertility in Nigeria's growing fertility industry. And by statistics, going by statistics, it will interest you to note that 1 in 4 couples will experience some level of infertility at some point, which means that 20 to 25% of couples do experience infertility. Well, we want you to stick around because there is more. We're not just talking about the financial costs of infertility, we're also talking about the emotional and the or rather the socio-economic impact also of infertility. Our guest is in the studio and I'll introduce him just in a bit. My name is Chige Chiagorom, and we want you to go on over to our social media platforms on YouTube, on Facebook, our Signature TV official. Go like, comment, share. We want to hear from you. Not forgetting that we're airing also on SLTV channel 265. Don't go anywhere.
Every second, every minute, every day, news is breaking. Events occur and there are new developments. At Signature TV, we follow these stories objectively, bringing all sides without bias, explaining the complex issues, breaking down the numbers, and investigating the issues behind the news. Anywhere and everywhere, near or far, wherever the news is, we will be there. Signature TV. News in your pocket.
Well, if you're just joining us, this is still Inside Health on Signature Television, and we are discussing the costs of infertility in Nigeria's growing fertility industry. And our guest is an expert. He's a consultant obstetrician and gynecologist. He's a fertility specialist, and he's also a minimal access surgeon. He's Dr. Innocent Anayochukwu Ugu. Welcome, Doctor, and thank you for joining us on the program.
Thank you for inviting me.
Absolutely.
And good evening, viewers.
I think the pleasure is actually ours, but all right. I see you're a minimal, well, other designations I understand, but a minimal access surgeon. Who is a minimal access surgeon?
Well,
and what does he do?
No, minimal access surgery on itself is a procedure, a type of surgery where you use a minimal incision, just little or no incision to do some surgeries. So those people who do that are called the minimal access surgeons.
Okay.
But
okay. So
it works. All the aspect of minimal access surgery also works in tandem with fertility investigations.
Yeah. Okay, that's fine. Now, infertility is a growing issue, and it's growing even after as time goes on. You did hear my introduction where I said I got that, by the way, from statistics online, that 20 to 25% of couples do experience infertility issues at some point in time. Now, if that is correct, we'll get to that, but I need you to, in very simple terms, explain what infertility is, because sometimes the layman thinks he knows exactly what infertility is, but I need you as a specialist to just define it. Let Mama Nkechi, that's the market woman in the market, have an understanding of infertility.
Okay, thank you for that. Infertility is inability of a couple to achieve conception or become pregnant after regular unprotected sexual intercourse for a period of about 1 year. So in other words, if they have lived together, practiced regular intercourse, and they are unable to achieve conception for up to 1 year, I would say that they have infertility. Yes.
All right. So if it's less than 1 year, it is not.
Strictly speaking, we say 1 year, but there are conditions that a couple may have that we may not want to wait for that 1 full year. But strictly speaking, by definition, it's 1 year.
Okay. There's another medical word that is coming to my mind now, which is sterility.
Okay.
Is infertility sterility? What is the difference?
In case of infertility, you talk about the male and the female or couple together. Sterility can be individually. A man can be sterile. Well, sterility could be a cause of infertility. But strictly speaking, you can't say both are the same.
Okay. Now, what are some of the causes? What are some of the causes and, of course, predisposing factors? Because I do realize that there are primary, causes,
yes,
and then there are secondary causes.
No, let me even put it, infertility is also further divided into primary infertility and secondary infertility. In primary infertility, both couples have not been pregnant before. Or let me say the woman has not been pregnant before.
She has never taken
in at all. That is primary infertility. In secondary infertility, she may have taken in before, whether she achieved a live baby or not, but she has taken it before. But subsequently, it's now finding it very difficult to become pregnant again. That is secondary infertility. There's also what we call unexplained infertility, which could be the primary and the secondary can also be classified into unexplained infertility. And what that one means is that we have totally investigated this woman and the husband who could not find out the cause of that infertility. We call it unexplained infertility.
Okay, so what are some of the causes? What are some of the things that can cause infertility?
Okay. Infertility can be caused by a problem coming from either the woman or the man, or both of them put together. But if I may start with the woman, there are lots of causes. And it's those causes that we target when we're investigating them, when we're looking at what is responsible for this infertility. It could be what we call ovarian factor, problem with the ovaries, which may affect ovulation. It could also be due to a uterine factor. It could also be due to a cervical factor.
I'm sorry to cut you short, doctor.
Okay.
Some people listening to you might not know what ovarian
Okay.
or uterine is. Could you just use the the regular English words for these parts of the body?
Okay. I will try.
Okay. I know it's not easy.
Yes, to make it simple.
Yes.
Well, like I said, infertility could be caused by problems from the man or from the woman, or both of them. And if I start from the woman, it can be problem coming from the ovary of that woman. It can also be problem coming from the womb of the woman. It could also be problem coming from the mouth of the womb of that woman. So let's talk about the ovary. It can also be hormonal problem, as the case may be. So let's talk about the womb of the woman. A woman may have a congenital abnormality affecting the womb. Problems she came out of the world with that may make her womb incapable of, carrying baby. It could be a cause. Sometimes things like fibroid, which we know, that occurs in the womb, you may just operate fibroid and the complications of that surgery may cause infertility. Again, the location of the fibroid in that womb too. If it stays in a place where the sperm passes through the womb to the tubes, it can also obstruct the sperm from getting into the tubes and then to go and fertilize the ovary. It may also cause that. The womb factor too, or the uterine factor. Some people when they have miscarriage or have what they call a criminal abortion, it may also affect the lining of the womb and may make it close. So these are also things in the womb that may cause that. There are other things that may cause infertility, especially in our environment. Infections generally. And that infection could come from sexually transmitted infections. It could also come from infections coming from a woman who delivered in a place that is not clean. It can also come from infection got from treatment of a woman who had miscarriage and was not treated in a hygienic and clean place. So infections could come into the body through that. And that infection may also damage the womb or damage the tubes of that woman. And these things can result to infertility. There are other causes of infertility, hormonal problems with what we call, I don't know how to explain this one, but the hypothalamo-pituitary gonadal axis, when there are abnormalities there, it may also cause
It's a part
infertility.
of the brain, right?
Yes, part of the brain that connects the reproductive organ. There might be some hormonal abnormalities there that may also lead to infertility. The other conditions, what we call polycystic ovarian syndrome,
PCOS.
can cause that PCOS or endometriosis. You know, this leads to some hormonal changes that may not allow a woman to ovulate very well. Other causes of infertility include age. It's known that as a woman advances.
We'll get to we'll get to that.
Okay.
Before we'll get to that. I guess they're under something like predisposing factors to infertility. Because
Well,
I don't want us to lose track of what we're talking about. Don't forget, we need to talk about the males. What causes
Okay.
infertility?
of
So
course, in
go on with
males,
the males.
in males are abnormalities with the sperm. Okay, it's that sperm that is the seed that is needed from the male for conception to occur. But for one reason or the other, some may not have it. There are congenital anomalies that can cause that. What we call Klinefelter syndrome, what we call Kalman syndrome. Those things they are congenital conditions
The man
that
was
may,
born with it.
yes, born with it, that may make you not to be able. There are also some infective causes in men, same sexually transmitted diseases that may affect where the sperm is being produced or where it is coming out from. It can also cause infertility. And a whole lot of other things in men.
Do men experience hormonal issues as women?
Yes, they experience hormonal issues too, like hyperprolactinemia. When they have excess prolactin in them, it can also cause infertility. They also experience hormonal issues. In fact, problems with the same hypothalamo-pituitary gonadal axis in men can also cause that infertility. But notably in our environment is that infective origin, infections, like sexually transmitted illnesses, and the whole lot of them.
All right, let's talk about lifestyle issues that can predispose either a man or a woman to
Yes.
infertility. Can you talk about, I know you did mention age for
Okay.
women. Are there
Yeah.
other lifestyle,
Yeah.
activities that can affect
Yes, there are
person's
lifestyle.
fertility?
There are lifestyle activities that can do that. People who are chronic alcoholics or chronic smokers, these are lifestyle that can actually affect fertility both in man and woman. Drug users too,
Hard drugs.
drug users, yes. Chronic alcoholics, chronic cigarette smokers. These are lifestyles that can actually affect fertility. Obesity, we become obese also from our,
A certain age.
yes, the way we eat.
And the way
Binge eating and development of obesity also affect, may also lead to infertility. Obesity may also be linked to other chronic medical illnesses like diabetes mellitus. I didn't remember to tell you those ones. There are other chronic medical illnesses that may predispose one to infertility, like diabetes, which is also linked to obesity we are talking about.
Yeah.
Thyroid disorders can also predispose
Explain
one
thyroid
to.
disorders. Could it be
We have the
that's for women?
for both men and women, but more pronounced in women. Thyroid disorders, diabetes mellitus, and other chronic medical illnesses may also predispose one to infertility. And that's why when we are managing them, if you have those conditions already, we may want to take care of that before we go to infertility management proper.
All right.
Yes.
Now, does age affect both genders when it comes to fertility? I know that, of course, for women it's pronounced, but is it the
Yes.
same thing with men? As men age, do they still produce quality, sperm cells?
Age, like you said, affects ability to reproduce, not only in human beings, but in other lower animals. But for women, human beings, by the time you get to 35, ability to become pregnant begins to dip. And as age advances, of course, it dips more, to the extent that by the time you're getting to 47, and your menstrual period may begin to cease and things like that. So really, age affects fertility more pronounced in women. In men also, age do affect fertility, but not as pronounced as in women. You know that as we age, other chronic medical illnesses may begin to creep in. hypertension, diabetes mellitus, and other diseases that may even affect the man's ability to have sexual intercourse, or that the drugs you are using to treat those medical conditions may also have effect on sperm production. So as you advance in your age, and those medical conditions are beginning to come in, apart from age on its own, it may also affect your ability to reproduce. So it does in men, but not as pronounced as in women.
Right. Now, you're the medical director of a fertility clinic here in Enugu. Would you say that, given your experience, that people are getting more infertile than they used to? Would you say that is a thing now? It's something that you notice, not really by research, but something you've noticed in practice? More people, young, middle-aged, whatever, they are getting more infertile, as the,
Yes.
years go by. What would you attribute it to?
Yes, I can say so, because based on my practice, it really worries me when you see very young people that you expect, got married to become pregnant immediately, and they still come with this problem of infertility. Yes, more people, are getting infertile, I'll put it that way. Because, worldwide, say about over 73 million couples suffer this infertility. And even in our own environment, up to 20 to 45% of a couple have this infertility. And what
young people?
Well, across the different, different ages. And well, what I can attribute to that, especially in our environment, is infective causes. When women deliver in an unhygienic environment, or due to the increased incidence of pelvic inflammatory diseases in our women, again, more people are becoming aware that there are other things which they don't know before that can be done to solve their infertility problems. So either because of the availability of these assisted reproductive techniques, or a combination of that availability and the presence of this infection, or increase in the incidence of pelvic inflammatory diseases, or two of them combined together. I think that's part of the reason why they are coming more, from what I noticed. In other words, what I mean is that before something like IVF came into being in this country, those who have attended clinics and their infertility problems seem to not to be solved except through IVF.
Yeah.
Before now, they don't know that those things exist, but now they know. So more of them are coming. So apart from that, infection is also another increase in the incidence of infection, or prevalence of infective conditions, and making them to come more.
Now, this might look like a conspiracy theory, but there's a school of thought that's saying that there's a global plan to reduce the population of people in Africa. Do you think we should beam our lights? I mean, the scientific community should beam her lights on certain pharmaceutical products that are coming into this country? Because how can you explain that a young, vibrant male, female got married, no prior history of infertility, no infection, yet they can't conceive? What are your thoughts?
I hear those theories.
Yes.
And to be honest, it worries me.
It does.
And being a fertility specialist, I know people will ask you, even in clinic. So I think our scientists, our researchers, our government should look deep into that. Because, come to look at it, the donor agencies that come from developed countries to come and help us, they're more interested in giving us contraception, family planning. But fertility, which WHO has defined as a disease on its own, has a great toll on women. They are not sponsoring that. Government is not actually helping. our health sector and our insurance services hardly cover infertility care. Yet, contraception, family planning, are aimed at
reducing.
Yes.
And you do know that some organizations, I mean non-governmental, that are faith-based, that decide they're not going to do preventive, just giving you this information. They don't believe in preventive, whatever, to HIV, so they don't talk about condoms, and they cut down their sponsorship drastically as a punitive reaction or something. So they are not, my point exactly is that they are not as interested in fertility as they are in prevention.
Yes, but why I said I can categorically say that they have an ulterior motive is that even also in developed countries, it's not all the people in developed countries that their insurance scheme covers fertility, just as we have in this place. But there are some there that can, to an extent, cover, the cost of fertility treatment.
Okay.
So I can't really say for sure that they are against our having children. I can't say, but there's no smoke without fire. I've heard that people ask me, but I can't prove it.
True.
So I can't just stand here to tell you that they have ulterior motive, but there's no smoke without fire.
All right. Now, before we get to the cost implications and other implications of infertility, the gaps that you have, talked about now, that is what your clinic and some other fertility clinics have come up to say, okay, let's bridge this gap in our society. Tell us exactly the different interventions that the couple that's been experiencing infertility can go through. You mentioned IVF.
Yeah.
There are still, I think there are two others. There's surrogacy. Yeah. Can you take us through them one after the other?
Yes. The infertile couples or couple struggling with infertility, they have options. And the options include, first, when they come to the clinic, let me put it this way, the options include presenting really, really on time. So when they come, they will now see that there are so many options left for them. When we ask them questions and examine them and investigate them, the thing is to treat whatever we think is the cause of that infertility. Like I said, if it's just ordinary hyperprolactinemia or problem with ovulation, in which the woman's tubes are patent and the husband's sperm is fine, we may just do what we call ordinary ovulation induction and timed sexual intercourse. We'll just try to help the woman to bring out, as in to stimulate egg production and release. And the husband can just go in and get her wife pregnant. If that works, that is fine. If it doesn't work, another thing we do, depending on what we find out on investigations, we can do what we call IUI, intrauterine insemination. But in that case, the woman must have a patent tube.
What do you mean by patent tube?
A patent tube, the tubes must be
free and...
Yes, it's not blocked. Because for us to do IUI, the sperm still has to pass through the tubes. So IUI is also an option. In that case, we do some treatment with the sperm, stimulate ovulation in the woman, and then inject the sperm into the woman in the laboratory. Okay. That's also an option that they have. Another option is other assisted reproductive techniques in which IVF, in vitro fertilization, is part of it, depending on the cause. If a woman's tube is totally blocked, the only option is that IVF. So it's an option. We may do IVF for that woman. There's another one we call IVF with ICSI, intracytoplasmic sperm injection. Is another assisted reproductive technique. There are so many of them. The ZIFT and the GIFT, what we call zygote intrafallopian transfer and gamete intrafallopian transfer.
And all these procedures are available?
And they are all available. They are all available in our center and available in most of the IVF centers in Enugu here. Other options available for them include adoption, surrogacy, depending on the cause of that infertility. So you can offer all this to assist.
Can you also assist with adoption?
No. Adoption has something also to do with the government.
Yes.
The only thing is you have to let them, if that is the only option, you may bring it to their awareness that they can actually go and adopt. And then we'll start searching for government establishments and agencies that could help.
All right,
that's
fine. How affordable are these procedures? Because someone listening to you now is itching to know. How affordable? You said they are available, established, but how affordable are they? Can you give us like a range? Yeah.
Well, I have to tell you, infertility treatment is costly. It's really costly. It's not somebody, it depends on the cost and the type of treatment you want to give. As you move from ovulation induction to IUI to IVF to all these ones I mentioned, the cost increases. But generally, it's a very costly thing. The investigations alone, because you don't just start treating, you start with investigations. Those things is one of the impediments that infertile couple, experience. They're costly. They are just costly. The investigations are costly,
and then
the treatment itself.
Yes. Are there guarantees? Is there a particular procedure that there's at least 90 to 100% guarantee?
No. Even the IUI we are talking about, in fact, it's not guaranteed. The only thing is that if you're able to identify the cause and properly treat it, then there is hope that the woman will get pregnant. But you don't tell the woman that I'm 100% sure that you're going to get pregnant. Something like IUI, they say success rate 1 in 10.
1 in 10.
1 in 10. Then IVF, even in developed countries, have about 20 to 35% success rate. So they are not guaranteed, and that's not add to the cost, because you pay that exorbitant amount. If it doesn't work out, you have to really come again. In some people, it could be 100%. So you do IVF, they carry triplets at a go. To them, is 100%. But generally speaking, you cannot just guarantee a woman that once I do this, you're going to become pregnant. So it's costly. In terms of price, you just asked about price of treatment. It depends on the kind of treatment you want to give. But for something like IVF, in this Enugu now, price range of about 3 million to about 4 million. But
the procedure?
Yes, the IVF procedure itself. But the fact it doesn't end there. Maybe this woman, on the course of investigation, you find that there are other factors involved that may also need money. So you need to take care of those factors before you even come to the price of the IVF. So usually we want to encourage them, they come, first evaluate them, sort out problems. If there are problems, then before we come to IVF proper. And that's where the cost you are talking about comes in. So when you're talking about cost, you look at cost of investigation, sorting out all those other problems, but the cost of the IVF proper. But by and large, it's cheaper in this environment compared to the developed countries.
It's really a sad story, but moving on, there's this new wave. You know how it is with blood donation, where there are commercial blood donors.
Yes.
So there's this, it even made the news today in the morning when we're talking on our morning show, where doctors were decrying young undergraduate students coming to donate their eggs for money, So is there a regulation available? Because this has to have a health implication of the young girls in the long run.
Yes.
What are your thoughts?
My thought is that, let me start by telling the public that most of the patients that undergo IVF, most of them they are old, 45, 47, probably
they are
50-year-old.
They are older.
Yes, women who does not produce quality eggs again. Even some of them don't menstruate again, so you cannot get egg from their body. The egg we use for them is from these young girls. It's not an illegal action. In developed countries, they donate. Egg. Just the way you can donate blood,
yes,
kidney, or any part of human body, eggs can also be donated. So when I hear those things in the social media about, selling people, nobody gets egg to sell. We just get the egg to assist those older women who cannot produce egg.
Based on donation?
Yes, strictly. Based on donation. And they donate for two reasons. Either for money. Abroad, in some areas, they donate for, not for money, call it altruistic reasons. So either they donate for money, they are paid, or they donate because they just want to donate without any financial gain. But the point I'm trying to make is that it's not an illegal thing. In developed countries, people donate eggs. But they donate sperm too.
Sure,
yes,
sure. What I'm actually thinking about is it's possible that there could be commercialization of this. More like a black market, an imagined black market where young girls know that they can go and get paid quick cash and just someone will just take their eggs.
I am not aware.
You wouldn't be.
I am not aware of that because you don't just get this egg and
it's not like urine.
Sell it like a goosey. You have to get the egg and put it where it will be viable. So if what you're saying is true, is it that there are some IVF center who assist in doing that? I am not aware. But I know these eggs is not for commercial purpose per se. It's just that all these older women who come for IVF, it's through donor egg programs that they're able to.
Donor egg programs?
Yes, that they're able to get, yes, they're able to get pregnant. What I mean, donor egg programs, we get eggs from those young ones. Yes, there are regulations, especially in developed countries. There are acts and laws guiding that. Of course, you don't, in this country I know, you don't take the age bracket is from 19 to about 28. That lady is not, in fact, some from 21 to about 28. You can't go and collect egg from a 14-year-old girl or a minor. So from between 21 and 28, these are adults. There are also regulations. Before they come for egg donation, we will screen them. It's not all of them that come that you will take. You have to screen for different diseases. And some of them, by the time you're telling them you are not qualified to donate, you see them even crying. Please take me. But you can't take her because she's not qualified. She has HIV. Yeah. You're not going to take her. She has other congenital abnormalities. Yeah. You won't take her. Are you getting me? So it's a legal thing and people donate egg. But like you say, regulations. There are some regulations. If you're not up to that 21, we're not going to take egg from you. Then we also educate them on egg donation, what it is, the available complications. They even have to sign some documents. Yes. So that, I mean, yes, they won't say you grab them on the street and you went for their eggs. They sign some documents. The process of the aspiration of egg to be also sign some documents. So it's not something, it's not hidden.
Right.
It's just that for us to assist those older women, we really have to get eggs from the younger ones. And this voluntary donation. They don't force you to come and donate egg. And in this environment, they all do it for money.
Yeah. Well, very quickly, before we go on a short break, I want you to speak to something. Now, assuming a lady or a couple goes through IVF like 2 to 3 times, is there any physical implication on the woman? Does it affect her health in a certain way? Just the way women who give birth through cesarean section are told after this number of children, it's not advised that you go again because of the toll it takes on the body. Does it take any toll physically on the woman to go through multiple IVF procedures?
Yes, I would say yes, in the sense that, IVF itself has some complications associated with it.
The procedure itself?
The procedure itself. Because for us to get that quantity of eggs from that woman, we have to hyper stimulate, as we have to make the body produce plenty eggs. And it's
a
medications, medications and hormones that we use to do that. Even amongst the girls that donate, when we stimulate, we tell them at least stay for about 6 months before you come again. Are you getting me? Stay about 6 months so that your ovaries will rest and come back to normal before you come again. And by the time they're donating 3-4 times, we ask them to stop. Are you getting me? So the same thing, a woman who is repeatedly doing IVF. The process itself has some complications. From ovarian stimulation, we can overstimulate them, which is what we call OHSS, ovarian hyperstimulation syndrome, even as we are doing the first one.
Wow.
And if it's a very severe one, it can lead to death.
Wow.
During the aspiration of the egg, there are also some complications associated with it. The pregnancy itself, remember that the patient took in through IVF does not mean that other complications that may be associated with pregnancy will not be there. No, they will be there. It's even more in them, in the sense that they may be carrying 2 or 3. So those complications associated with the process of the IVF itself, carrying the pregnancy up to delivery, is not something you would want any woman to be doing year after year. And remember, here we don't just put one. Here, you might just deliver twin triplets in the first attempt. I'm sure she's going to she'll rest, yes, for the next 2-3 years, because she'll be willing to come. And so it's it's not the cost implication alone will not even allow them to come so frequently like this. The complications associated with them will not allow them to do it. But if I may just answer you, it's not something, of course, if you do repeatedly year after year, which is not possible due to the cost and other things, you may land yourself in some troubles because of the risk associated with the procedure itself.
Right.
I don't know whether...
Yes, you did.
Okay.
Yes, you did.
Yeah.
All right, so we'll go on a short break, and when we get back, we'll be busting some myths. Do stay with us.
With a population of about 36 million people, the Southeast is awash with stories. Every day on Southeast News, we tell the peculiar story of the Southeast and her people.
Our Southeast should be the Silicon Valley of Nigeria.
Their successes, achievements, and daily challenges. Do you have a Southeast story to share? Community achievements and challenges, completed and uncompleted projects, bad roads, water scarcity, erosion, flooding, insecurity, or even disagreements? Bring it on to Southeast News. On Southeast News, no story is too big or too small. Southeast News. Let's tell our story. Showing on Signature TV every weekday at 4 p.m. WAT, 1600 hours GMT.
Many thanks for staying with us. Don't forget that we're still talking infertility. The costs of infertility in Nigeria's growing fertility industry, and we still have Dr. Innocent Anayo-Chukwugu in the studio doing justice to this topic. Now, before we went on the break, I did say that we're going to be busting some myths. What it means is that you're going to be answering direct questions from misconceptions that people have about infertility. So the first one is, infertility is always the woman's fault. Now, I know that there's this statistics around it. So is it always the woman's fault, or is it 50-50?
No, it's not always the woman's fault.
Okay.
And that is the problem we have in this area. In fact, when it comes to contribution, it's said 30 to 40% of infertility is from the woman. Cause of infertility is from the woman. The other 30 to 40% is from the man. So it cannot be from the woman alone. But in this environment, the whole burden
Is on the woman.
is on the woman. And that is what, I don't know.
I should ask you, in your clinic, do you see this scenario play out where it's only the woman coming first, and then reluctantly the husband might just tag along?
No.
Or they often come together?
You rarely see the man and the woman coming together. The woman usually comes first. And at the time, the man may even find it difficult to accompany the woman, telling the woman that you are
the cause.
Yes, because oftentimes when I demand for their husband, And you hear the woman telling you that, Oga, check me first.
Oh my.
The man never believed he has a problem. Eventually, when the man comes, you may find out that he's even the person responsible for the infertility. So it's not always
It's
the
not
woman.
always the woman.
Yes.
So
it's
do
not always
you
the
do
woman.
some kind of counseling? Because you
Yes.
have to.
Yes.
When you see these things, how do you go about it?
No, really, you have to counsel them. You have to counsel them. If you get the man, I make every effort to get the man involved. And you have to start. There's no way you can treat infertility without proper counseling, because it has a lot of
Emotional and psychological
psychological,
aspects.
economic
Yes.
consequences.
Those are the implications.
Yes, you really have to. You start treatment with counseling. Because if you don't counsel, some of them may even abandon the treatment halfway and go. And the problem remains. So we'll counsel them that there's a need for both of you to come. So they'll properly, evaluate and find out where the problem is from. Because you can imagine if the problem is not from the woman and the woman continue to visit you. You're not going to get anywhere.
True.
So we'll counsel
How
them
do you
that-
even manage your emotions? Because
no,
you're always listening to people's issues,
Yes,
the complications around it,
yes,
family
sir.
issues.
Yes,
How
sir.
do you manage your own, emotions?
we have to, because that's what we are trained to
Yeah.
do. But it's also not easy, especially when it comes to IVF, and you do it and it's not successful. It can be a lot of emotional trauma on you yourself.
Sure.
Yes. So it's not only the woman.
Sure. All right. Traditional herbs and spiritual remedies are more effective or as effective as medical treatment. Someone will say there are plenty ways to kill a rat.
No,
Does
from
that apply in this case?
No, from my own knowledge, it is not more effective than medical treatment. It's not even as effective as medical treatment.
Okay.
I think medical treatment is more effective than that. Why did I say that? We find that the first, because of either cost or whatever reason, or culture or whatever, they get to those traditional people, waste a lot of money, even harm themselves, and finally they come to hospital. So they themselves know that it's not even as effective as medical, and it's not more effective than medical. But maybe cost, culture, our custom, push them to those traditional things. Eventually they come back to us, which means it's not more effective
didn't get
than the
the
medical.
answer
Yes,
they were looking
when
for.
they get there, they still come back. So,
Okay. Okay, this is very funny. If you can't conceive naturally, you're not meant to be a parent. Maybe based on culture or superstition. Maybe it's the will of God, which was why I told you that you have to do a lot of counseling.
yes.
When do you get to that point when you notice that your patient is about pulling away from, treatments from an already, instituted treatment?
Well, if you counsel them well, they are not likely to do that. But like you said, if you can't conceive naturally that you are what? You're not a woman or something like that. It's not true now. Even from the Bible days, there were people who had infertility. Yes. So the one happening now cannot be. Yes, if you conceive naturally, no problem. So thank God. But there are
Yes.
still some percentage of women who cannot. And when they present on time, we can make them get pregnant.
Sure.
And you get pregnant. You don't become a woman that people say you are not, or
Yeah.
a mother that people say you are not.
Now, when these women, when they conceive, at least those who give birth to triplets, do they still, do you still follow them up, or you refer them to antenatal clinics, other places, or you follow them up until when they give birth?
Most times when they get pregnant, we refer them to antenatal centers,
Okay.
where the pregnancy can be managed. Sometimes some of them will refuse, yes, to
Understandably
go to
so.
other places. Those ones will still have a way of doing antenatal care for them and delivering them. Yes. But if they wish to, like some of them may come from Lagos, from Abuja, you get them pregnant, they have to go back there and then register antenatal in a nearby place to where they reside. But some who resides here in Enugu may not agree to go to another place, or will try to persuade them to go. Or if they refuse, still have a way of doing antenatal care for them and still deliver them.
Some couple would rather go childless than go through surrogacy. What do you think?
Well, it depends on choice.
You didn't quite explain what surrogacy means. Explain it first.
It just in common terms means another woman carrying baby
Okay.
for someone.
Is it the woman's eggs and the husband, the other
It
one's
could,
husband?
it could be. Just in simple terms, let me say, I'm a woman now, and my womb is not good. Doctor has advised that, or maybe you've done repeated IVF, due to uterine factor is not working. They just go to contract a woman that may carry baby for you. And when that woman delivers that baby, the woman gives you back your baby. So it could be your own egg if you're young. Bring out your egg, use your husband's sperm. Then fertilize the egg,
Okay.
then put the baby inside of the woman who could carry the baby, because you on my own womb as a woman is not functioning well. So we put the baby in the womb of another woman who will carry that pregnancy. She is paid. And then when she delivers, you take your child.
With
So
the child?
in that case, the child is genetically yours.
I was going to say, will the child carry any genetic material from
No,
his-
the child is
his,
genetically
the-
yours because the egg is yours and the sperm is your husband's. But there are conditions where the woman is old. She hasn't got any egg again. Her womb is also not fine. So in that case, we may also borrow egg from donor and then use the husband's sperm. Still fertilize, put the baby in another woman that will carry the baby. After they carry, they take their baby. Sometimes the sperm may also not be good. The woman is old, has got no egg, still borrow sperm. Then borrow the egg. And then still find a surrogate mother. So it depends on the scenario.
Yeah.
But then that surrogacy means another woman carrying baby for another.
For
and at the
another.
end, you don't give the baby to.
Based on the agreements.
Yes.
All right, finally, before I let you go, 'cause I think I've overstretched you.
It's all right.
But it's been a great time. It's finally, I think you've answered this in some ways. Fertility treatment guarantees a baby.
Yeah, yes. But not 100% guarantee, depending on what is the cause. Yes.
Depending on what it-
But if it's properly, the cause is properly identified and sorted out, yes, I can guarantee you a baby.
All right, as a parting shot, what advice would you have for young people, young couple, or even those that are not married yet to ensure they don't predispose themselves to infertility in the future?
Well, let me start by quoting this statement. Say fertility is a silent thief of a woman's psychological stability
Wow.
and sanity in one hand. Socio-economic status and significance. On the other hand, he said it strips a woman the joy of womanhood and motherhood, and leaves the woman completely disenfranchised from the very essence of humanity. In
This
other words,
social impact is
yes.
more on the woman.
yes. So this infertility, WHO has defined it as a disease entity. Yes.
With
It's a
symptoms
disease entity.
and
Yes, because you look at it, something affects you socially, affects you psychologically, affects you economically,
financially.
affects you psychologically. I mean, that is the same thing other diseases do. So your question on what do I advise young girls to do? That question is like, how do we prevent infertility? We prevent infertility by avoiding all those causes we mentioned about. In terms of infection, abstinence, being faithful to your partner, or using condom to avoid those infections. If you've got infections, present to hospital on time so that we'll treat you before the thing damages your reproductive organs. Education. We have to really educate these children from
Sex education.
From the scratch, yes. Reproductive and sexual health education. We have to inculcate it in our primary and secondary schools, so that before they grow into maturity, they have known what are the causes, how are we going to prevent them. Lifestyle modifications too, in order to combat the risk factors associated with fertility. I think these are the things. Then government should also assist couples who are infertile, because I think most of them, when they have problems, the reason why they go to all those tradomedical people is that they don't have money to approach the
clinics.
Yes, the clinics. Government should have a way of subsidizing their treatment. Donor agencies should look into that. So if we're able to prevent all those risk factors and causes, we'll be able to reduce infertility. Because if it has come, it has come. Maybe we didn't have time to go into the apart from cost, other implications of infertility.
Mental health.
Yes, they are numerous.
All right. Maybe we'll have you back for a second part of this interview, because there's a lot of sides and perspectives to this. All right, Dr. Anayajuku Innocent Ubu, thank you so much for your time. He's a consultant gynecologist and obstetrician, a fertility specialist, and minimal access surgeon. I learned that today. Thank you so much for your time on the show.
Thank you.
All right, there you have it, friends. I'm sure you must have picked a thing or two. Don't forget, your health is your responsibility. We want to hear from you, so go on over to our social media platforms on Facebook, on YouTube at Signature TV Official. Go like, comment, share your views, share your thoughts, and probably your experiences. Don't forget to be on SLT channel 265, and do go and download the Signature TV app on Google Play. Well, that's how much we can take. I'm still your host, Chigichi Agorom. Bye for now.